Hello and welcome to the presentation of tips and tricks for translating GAMP theory to everyday actions. My name is Angela Bazigos, and I am actually one of the people that are responsible for the creation of 21 CFR 11, which led to GAMP 5 being created. So I apologize for anything I might have done that is keeping you awake at night. And I have a lot of experience with computer systems validation, as you can see from my, and with GAMP5, as you can see from my bio. Today's presentation will be in 5 different sections. The first one, we're going to have a quick introduction to GAMP5. Now, I'm sure everyone is an expert on GAMP5, but I want to make sure we start from the same place. So we'll have a quick introduction to GAMP5 and how it fits with regulations. Now, GAMP5 is about computerized systems validation, so we'll go a little bit more into that, because that then will set the stage for the implementation part of GAMP5. After that, we'll talk about the 10 deadly sins. Do not make any of these sins. And then we will have a Q&A session where you will be able to ask any questions you might have. So let's start off with a quick introduction to GAMP5. So in case you are not familiar, or even if you are familiar, the way that regulations, guidance documents, and SOPs work is that a regulatory authority, and I am going to use FDA as the example, but when I say FDA, I mean any regulatory authority. They come up with a regulation. Now, regulation is very constant. It tends to not change over the years. But what does change is the thinking of the regulatory authority, which basically leads to what are known as guidance documents. And you will often see something that says, our current thinking is. Now, once you have a guidance document, you create an SOP for your company. And I want to clarify that the SOP that you create in your company, that is the law. So you can decide not to follow a guidance, something in a guidance document, if you can substantiate it scientifically or in other ways. But once you've written the SOP has to be followed no matter what. FDA will test you, will inspect you against your SOP. Now, what happened was that we had the regulations for Part 21 CFR 11 and Annex 11, so the Part 11s. And for FDA, we have a document, or we have a guidance document called General Principles of Software Validation. This is one of the ones that I co-authored. Now, this is a very complex guidance, and GAMP5 comes in to give the drill down on the guidance document, as if you like, and then you create your SOP based on the GAMP5. So for example, for the GAMP5, we really will be looking at 21 CFR 1110A, and then your validation SOP will be based on GAMP5. And I hope this makes sense. So the objective of today's presentation is, after many, many years of working on GAMP5 and these validations, I have some tips and tricks that use a lean documentation approach that will save you a lot of effort, which also means errors will be reduced. And because you will be able to focus on the quality of the implementation of GAMP5, the actual quality of your implementation will increase, which of course will mean, number one, it's good business, and number two, it has good inspection outcomes. I want to put a caveat here. This is my experience. It does not bind FDA or other regulatory agency to inspect as described in the presentation. And also, I do use GAMP deliverables templates, but they're not going to be part of this presentation. This can be discussed after the conference if anyone is interested. All right, so this is GAMP5. It's to help us translate the general principles of software validation and equivalent guidance documents internationally to something that we can do. Now, like I said, GAMP 5 is based on 21 CFR 1110A. So this states validation of systems to ensure accuracy, reliability, consistent intended performance, and the ability to discern invalid or altered records. There are other parts of 21 CFR 11, but in a very weird way, when we were writing it, all the other parts are actually implemented under 21 CFR 1110A. So what is computer systems validation? What does it mean? Consistent, accurate, you can discern invalid records. So let me give you an example. This is a true example, true story. And you may remember the father of quality. You may be familiar with Professor Deming. And he came up with a method way back when in the 80s. The method was called total quality management. Today, we have given it sexier names. We call it things like Six Sigma or quality by design, but it is effectively the same methodology that Professor Deming came up with. Now, he tried to implement TQM, total quality management, in the US, but the US refused, so Professor Deming went to Japan and implemented it in Japan, which is the reason Japanese are famed for their quality processes. But what happened is once Japanese had implemented TQM, American companies would, for example, order items from Japan. And I do not know if you know this, but if we order items in bulk, say we order 10,000 glass test tubes, we have something that we call an acceptance threshold. What that means is, look, if you give us 10,000 glass test tubes, you can have up to, say, 6 test tubes that are faulty. So faulty could be broken, because we get it. You know, you have to get the test tubes from the pallets in the warehouse, then you have to put them in the loading dock, then the pallets are transported across the country in trains or planes or whatever. Then they're, sorry about that, then they arrive at the receiving dock of our company, and then finally they arrive at the lab. So we just know all these test tubes, they are at risk for becoming faulty, so breaking. So an American company ordered 10,000 test tubes, glass test tubes from a Japanese company, and a few weeks later, they got a big box with 9,994 glass test tubes, and then they got the little box, and they were a little bit puzzled about the little box, and they opened the little box, and they found some broken test tubes. And they also found a letter that said, "We do not understand why you wanted faulty test tubes. Here they are, wrapped separately." So first of all, I always get goosebumps with this story, because the glass test tubes could be a pacemaker that's running somebody's heart, or a ventilator that's helping a baby breathe, or something like that. So what we're trying to do with computer systems validation is come up with this: everything is consistent, we know exactly where it is, and anything that is faulty or invalid is wrapped separately. So no pressure, folks. This is what we're going to do. So let me explain computerized systems validation in very high terms, and this is GAMP 5 in very high terms. It has 5 stages, and the stages are planning, specification, configuration or coding, then verification, and then reporting. Now, this might look like the waterfall methodology that we used to discussed way back when. And when we were writing 21 CFR 11, some geek, and I'm still jealous that I did not think of this first, said, oh, it's validation. Why don't we make this into a V? So now we have the validation V, and pretty much what used to be the waterfall validation. For those of you that are already ready to protest because, oh no, we use Agile, worry not. It does not matter what methodology you use. What we're saying is these are the deliverables you have to make available for GAMP 5 implementation. And you can use object-oriented analysis, you can use Agile, you can use whatever you like, so long as the deliverables are here. So those of you who thought we cannot do GAMP 5 because we're using a different methodology, yeah, we just want the deliverables, that's all. All righty, so what do these stages mean? Let's get completely away from computers and let's compare this to buying a car, because these are very simple concepts. And when we wrote part 11, we tried to make it very simple and sustainable and scalable. So let's start with applying this methodology to buying a car. Let me tell you a little bit about this car. So first of all, would you just wake up one morning and go buy a car? Probably not. Probably you have thought about it. Probably you have chatted with friends and colleagues and discussed what you're looking for. Certainly, hopefully, you have talked to your family. And I want to tell you something about your family. You have a spouse, you have 2 children, you have a dog, and your grandma lives with a family. And oh, by the way, grandma is incontinent, so she might not be able to hold it all for every trip. So this gives you what you might need. These are your requirements. So based on your plan, now you can specify your requirements. What type of car, any special features? Because remember, grandma, she cannot always hold it. So for example, your requirement would be to be able to clean the car seat after grandma had an accident. And if you have a dog, you certainly want to have a space for a dog. So, and you also want things about cost and other constraints. Now, what you would usually do, you have decided what your requirements are. What you would usually do, and you would have decided what car, you would go on the dealership website. Let's pretend you're buying this from a dealership, whether it is pre-owned or new, and you would pick the car. And then as you're picking it, you get questions like, what color would you like? Would you like steel rim tires? Would you like heated seats? And you just check yes, 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 no, yes, no, and you get as many of the features as you desire. So for example, one of the features we discussed are the easy to clean seats, but you might not get, which is important, it's a high priority, but you might not get the steel rim tires, which is not a high priority. So if you do not get something, you would say, okay, this is the reason I did not get it. It's not a high priority. Now, you would not buy the car on the website. You would actually go to the dealership and drive the car to make sure it's what you thought it was. And if it isn't, and by the way, the previous slide was talking about configuration, or if you build the car yourself, if you are a person who has a hobby to build cars, that would be coding. But now we have to verify that the car is behaving the way it's supposed to, or we expect it to be behaving, not the way it's supposed to, the way we expect it. This is the intended use. We expect it to behave in a particular way. And say you bought your car, you come out of the dealership. What are you going to do? First thing, what are you going to do? Of course, you're going to brag. You're going to go to your friends and your co-workers and your neighbors, and you are going to brag about your new car. And you are going to say, and this is a true story for me, well, I was going to buy a low-speed car because I used to get a lot of speeding tickets. So I thought, I will buy a car that cannot go very fast. And then I went to the dealership and they put me in a sports car. And of course, I ended up buying the sports car. So the actual did not quite go according to plan. And of course, I explained I just loved the sports car so much, I ended up with a sports car. This is called reporting. And here we have all the stages of a GAMP 5 implementation. We also have all the stages of the IEEE engineering standard for system implementation. So with that, hopefully you understand what, the framework of what needs to happen. And now we're going to look at the deliverables in a little bit more detail. Remember what I said, we're not going to actually be looking at deliverables templates. What we're going to be doing here is giving tips and tricks to make implementation of GAMP 5 deliverables much easier, less effort, fewer errors, higher quality. And as I mentioned, if you would like to discuss templates, that's something we can do after the conference. So the first thing you want to do is to have all systems inventory. This needs to be there whether the system is GXP or not. And then you have a classification that says, okay, this is GXP, and it only say has electronic records. For example, if you have a pacemaker, you might not want to have a signature after a heartbeat, but a different system might have electronic signatures. Then you need to determine the degree of compliance that each system has at this particular point, and then you want to bring the system to compliance at which it is supposed to be. And then you have to say, when is the next time I'm going to be looking at this system for revalidation, for periodic review, whatever you might want to do. Some companies use paper. I have 2 SOPs and 3 templates for this. Some other companies, they put it as part of the equipment maintenance software. It does not, again, what I really want to stress is so long as the deliverables are there, that is fine. How you do it is not as important, because what regulatory agencies look at are the deliverables. They can compare the deliverables against GAMP 5. Your methodology is individual to you. You have seen one, if you have seen one methodology, you have seen one methodology. So in order to standardize so that all agencies are inspecting against the same thing, we have the deliverables of GAMP 5, and that is what you're supposed to be generating, however you decide to generate them. So systems inventory is the first thing you want to do, because the thing about GAMP 5, it's about control. We're controlling systems. It is also not about perfection. If there is an issue, we know it's an issue, and we make sure, for example, we're going to say this is by when we will bring the system to compliance. And by the way, I asked FDA, I have a lot of FDA friends now, having worked with them for so long, but I asked FDA, and some of my clients are very small and they have not completely gotten their compliance there yet. And I said to FDA, what do you do? And this FDA person said, you make a list of what needs to be done for each system to be brought to compliance, and then you put timelines to it. And then he said, this cuts us off at the knees, because if we were to give you a citation, that's exactly what you would have to tell us, how you will bring the system to compliance and when you would do it by. So if you have already done this work, there's no point in us giving you a citation. So this is really important, and this is something that you have that you can demonstrate you're in control of systems. So systems inventory. So what I like to do, and we talked about lean documentation, what I like to do is create a validation master plan for all the systems that you're going to be bringing to compliance. Now, we will see later that you have things that are the same from project to project to project. So in this plan, use the common language or the common requirements, so you do not have to reinvent the wheel for every validation that you're doing. And we will see some more explanation of this in subsequent slides. Now, different companies call validation master plan, sometimes validation master plan is the manufacturing plan, there is master validation plan, there's many words. And to avoid confusing them, I have used the term VAMP. The reason I use VAMP is because the first time I put a validation master plan together, Chanel had come out with brown-red nail polish, which I really liked, and the nail polish was called VAMP. So I call my validation master plans for validation projects VAMP. I just thought I'd put that out there in case you need to use the word. And like I said, there's 2 SOPs and 3 forms, 1 SOP for inventorying the systems, 1 for classifying them in GXP versus non-GXP, and then if GXP, electronic records only, or electronic records and electronic signatures. So from that, we're going to go to, excuse me, to validation. Now, this is the validation V, as you will see it in the GAMP manual. And we have a validation plan. These are the different sections. And we have a validation report. Because remember, in our industry, we have bookends. If you have a plan, you need to have a report. And then we have these different deliverables that we need to include in what I call a validation portfolio. Okay, I call this set of documents the validation portfolio. So these are the different deliverables. And also, I'd like you to pay attention to this as a user requirement specification and a functional specification. I like to put those in a single document, but you know, this is the foundation of GAMP 5. There's a couple more things that we need to do. For example, traceability matrix, a test plan, and we'll go through those, excuse me, in the rest of the presentation. Now, that was the validation deliverables in GAMP speak. Many times I see IT people get very confused. However, please note that it's the same as IT deliverables, and you have your user requirements, functional requirements, design or configuration, code for custom systems, unit testing, installation testing, and then what is called OQ is everything, and then PQ is user acceptance testing. The reason we have this IQ, OQ, PQ words, and I'm sorry, I'll say on this slide, is because when we were talking to FDA about validation, they were only familiar with process validation. So they kept saying IQ, OQ, PQ, and we were saying, what are you talking about? So we came up with this agreement of using these terms of IQ, OQ, PQ, but as we will see during subsequent slides, they mean slightly, you know, they pretty much mean the same things. I just like to group all the, you know, functional testing, integration testing, security testing. I just put them in OQ. And as the years have gone by, just to make things even more efficient, I put unit testing under OQ. And of course, we have the risk analysis, the software development lifecycle, which is basically GAMP 5, and the traceability matrix. So hopefully this correlates IT speak to FDA speak. Now, a couple of tips and tricks. As you saw, there is an SOP for the system development lifecycle. What I have seen in companies, and I am referring to small molecule, large molecule, medical devices, it doesn't matter. I have seen them have 2 different SOPs for GXP systems versus non-GXP systems. I remember I've been doing this for a very long time. What I have found, it's actually more efficient to have a single SOP and just reduce the amount of information that you need in the non-GXP systems. And this is for two reasons. Validation is really good software engineering with a documentation on steroids. Basically, we want to slow you down so that the system is able to be inserted to run somebody's heart or to have a baby breathing. So that's the first thing. If you have two different, so you can just put in your documentation, these are all the sections that you use for validation on GXP systems, and these you do not need to use these sections for non-GXP systems. The other thing is, if you have different SOPs, people can run the wrong SOP. And I have had instances where, for example, for a big 20 company, we had, oh my gosh, 150 HPLC instruments and then 150 Agilent, and the IT team was doing an upgrade for a virus, it was a patch, but they used the non-GXP SOP. So the Agilent were okay, the HP all crashed, and then we had to go through doing Kappa, then doing change control, then reinstalling them, retesting them. So you can do a lot of damage just by using the wrong SOP. That's why I suggest, use the same SOPs and then just change the amount of documentation. Now, the SOP for validation, you can just say it's a validation SOP, or you can call it a system lifecycle SOP. It's up to you, but I usually recommend a system lifecycle, so it's for every system. Now, we've said all this, and the question is, what are the systems that actually need to be compliant? And basically, anything that somehow, somewhere will end up touching a product or a patient. And the other way to say this is somehow, somewhere, it will result in a submission to the agency. So I would like to point out that you want all records with controlled GXP data. And I am very sorry because my mouse is extremely sensitive. And then all records used to make quality decisions. And if you have some records that do not fit in the previous two examples, but they will somehow, somewhere submit it to a regulatory agency, they have to be electronic records compliant. So GAMP 5 will apply. I also want to make a clarification of a validation and versus verification, or vice versa. So verification is ensuring that the quality is there, but this is after the fact. So you made something and you hope it has worked. Validation is building quality into the system. Building quality into the system is 21 CFR 1110A. So GAMP 5 is helping build quality into the system. And of course, as part of validation, you do verification, which is the testing part of the system. If you wait until the testing part, you're going to have a lot of errors and issues. So let's start with the document that tells us the deliverables that need to be generated. And this is the validation plan. And I'm not going to go through it in details because hopefully you're already familiar with the deliverables. But your validation plan is telling you how you're going to build quality into the system. So you will have your different deliverables. And as you can see, they match different testing modules or modalities. So, for example, the architecture design will be matched to integration testing, and then the system design will be matched to system testing. And of course, you can put the integration testing and the system design into OQ. But validation plan says this is how we're going to build quality into the system. So effectively, what you want to do is to describe your validation portfolio. Now, your validation plan can be based on your project charter, which is effectively you will have to have done when you first started the project. However, there are some documents that we use for project management, for example, the project charter, that are not required by regulations. For example, timelines and costs are not required by regulations. Do not include something in a controlled document like a validation plan if it is not required by a regulation. You're opening the door to having regulatory authorities look at other things. Now, sometimes, and the validation guidance says something about timelines, and so does GAMP 5, but I just put that, requirements will happen first, and then design will happen afterwards. And oh, by the way, testing will happen after the system has been implemented. You do not want to be including detail that will not that will open the door for other things. The other thing is, as an auditor, the first thing I would do is look at the things that are common amongst documents, say, for example, definitions or system description, and make sure that they're the same from system to system. Well, this is low-hanging fruit. You can find issues with system to system, a system description to system description between documents. So do two lean documentation things. Number one, use your validation plan as the reference. So anything that is going to be common in other documents like system description, definitions, roles, put them all in the validation plan. And then when you're creating your other documents, just say reference validation plan. So do not repeat information. It does not add value, and it just costs more and you spend more time. And I want to point out that the validation plan is what you plan to do. This is, we have a validation summary report that will be bragging and saying what we actually did. In the validation plan, include supplier assessment, because that gives us the risk. Include whether you have a horizontal or vertical infrastructure qualification. Horizontal is when all the infrastructure has been qualified and or validated. Vertical is if you're going to do it per project. Include the environments, dev, val, and prod, and be very clear that dev is not controlled and it is outside the scope of the validation. You do not want FDA going into dev. And then you need to include all the items in this presentation and more. Risk. Now, risk, I am going to point you to the fact that there is severity and probability on the one hand, and the greater the severity and probability, the higher the risk. And then you calculate the risk class by multiplying severity by probability. And then you look into detectability. And the more detectable the issue, the lower the risk. So this is backwards, because if it's easy to see that there is an issue, then no problem. If it's not easy to see, it can go through and cause problems to patients. So risk, and this is the risk assessment. People say, well, how do I know where to put risk? Well, GAMP 5 very helpfully gives you all this information, where to find risk, and some things that you want to pay attention to is GAMP 5 has categories, which 1, 3, 4, and 5. And the higher the category, the higher the risk. If you have a custom component, that's the highest risk, the bespoke software. And if you have a COTS system that has bespoke components, you test the COTS components at the lower risk level, and you only test the custom software at the higher level. So you do not need to do the highest level of risk across all components. There is also infrastructure software, like, for example, operating systems versus infrastructure hardware, such as servers. So do not mix those up. They are actually different. And infrastructure has classes as well. And some infrastructure software needs to be validated, for example, network. And make sure you decide whether you want horizontal or vertical. Whatever you have done, you will need to have an infrastructure qualification plan and infrastructure qualification report as part of your infrastructure qualification. So as part of the validation project, you want to get hold of those documents and add them to your portfolio. You want to include, like I said, supplier assessment risks because remember, validation is like being pregnant. You're either pregnant or you're not. You cannot be a little bit pregnant, so you cannot be a little bit validated. So if the supplier is missing something, then you have to do it. And you can put it in a risk document, but also I like to create requirements for the mitigation of the risk. Use a known risk assessment methodology, whether it's ICH Q9, ISO 14971, or GAMP 5 methodology. I have seen warning letters for people who try to make up their own methodology. And bear in mind that the closer the system is to a patient or a product, the higher the risk. Next, let's look at requirements. Okay, if processes and data were to get married and have children, that child would be the requirements document. So in terms of requirements, you need both processes and you need data. Whether I often see requirements that are just processes. Data can be an entity relationship diagram, it can be data flow. You need both. The processes say what you're doing to the data, and the data will tell you how to make your database so that processes connect on the data. Now, please note, and we're still talking about requirements, in any system lifecycle, you will have three components. The first component is where you have the planning, you plan what data you want. For example, this clinical trial will enroll 36 healthy volunteers. And then you also say, okay, we have enrolled 33, and you track against what you needed to do. Now, the next thing is this is completing the data entry. What I mean by that is data is rarely fully clean when you receive it. It has to be cleaned up, and then it has to be prepared for analysis. For example, you might need to attach an algorithm to it. And once you've done that, of course, you can do the analysis and the reporting. The reason I'm saying this is, and we will see this in requirements stages in a slide or two, you have to have all of these in a system. Now, some of them are not applicable. Say if you have a refrigerator, a temperature tracking system, you do not have data cleanup, but somehow, somewhere, you will find these, even if they're in a very stunted way. Which means that when you come to requirements, there's two sets of requirements. The requirements on the left are something that changes from system to system. So you can see configuration, design, collection, tracking, and then you see the data cleanup, analysis preparation, and then the reporting. And on the right-hand side, you have requirements that are the same from system to system. Now, workflow requirements might be specific to a particular system, might not, but notice things like backup and recovery, archive and de-archive, audit trail, 21 CFR 11 requirements, all those are the same from system to system. So write them once and just reuse them. Same with testing, write the test scripts once and then reuse them. Also, I want you to know that requirements are what the user wants. For example, the system security. This is user requirements. And then functional requirements are a little bit more detailed. For example, when the user says system security, they want a username of initial dot last name. and a password, which is 8 to 12 characters, including special characters. You can have two separate documents. I don't see the point. It's just more things to do. I just like to put both of them into a single document and just, drill down on the user requirement to include the functional requirement. Now, people get confused with configuration versus custom requirements. These are a matter of degree, not of kind. What I mean by that is a custom system will just have more detail. So for example, say you have a safety system and that has adverse events, and you have a field of adverse event severity. In a COTS system, in a configurable system, you would write needs to attributes severity or click on severity. In the custom system, it would say severity is 6 alpha characters. It has options of mild, medium, severe, and the field cannot be left blank. In a COTS system, this has already been done by the system vendor. So you still need the same requirements. You just need a different level of detail. And like I said, some requirements, for example, the security are the same from system to system. Requirements can change, they can be removed. If that happens, do not remove the requirement. Just void it out, because if you change it from the requirements, then all the downstream documents have to be changed. So just the numbering, it's not the actual requirements, the numbering. So just write void and leave it there. And what I like to do is I always put the order in the document the way I showed you in the requirement section slides, and then I put my design in the same order. I put my test scripts in the same order, so I can keep it easy to trace from one document to another. Now, requirements, as we said, whether it's user or functional, is what the user wants. Design is what the user gets. And this is for the system. Some things cannot be included in the system, therefore we need to control with an SOP. Also, COTS is mostly configuration, custom is coding, but I've never met a COTS that does not involve at least some custom work, so bear that in mind. One of the things I like to do is add lists as appendices as much as possible. For example, lists for security roles or lists for error messages. And then when I am testing the system, so you add them to your design or configuration document, instead of testing this as a script, is included in the IQ and put the list from the design or from the requirements on one field of an Excel spreadsheet, then dump out the database fields, put them in another field, and then use the Excel compare function, which I think if this cell equals to that cell, then true, else false. So that you do not have to write a lot of test cases. You can just get Excel to do the testing. And also, I include the unit testing in OQ. Plus, it helps QA because, especially if you have a custom design, a QA can go and look at, say, the error messages in the body of the design specification and the error messages that are in the database and be able to sign off in the review that this has been done correctly. Now, we have created the requirements on the configuration or design, but remember, what we're trying to do is prove that the system is meeting intended use, because validation is a process of making sure that you document objective evidence that user needs and intended users are met and consistently provide the intended benefit. So this is your traceability matrix. And remember in school, we were saying, okay, if A equals to B and B equals to C, then A equals to C. So the trace matrix says, if the requirements are implemented by design, and you say this is the requirement, this is where you find it in design, and when I say design, could be configuration, and then if design is tested by IQ, OQ, PQ, that means the requirements can be proven to be tested by IQ, OQ, PQ. It's just a simple equation. When you write your traceability matrix, make sure that you write the requirements description because it's very hard to read otherwise. And now the trace matrix needs to actually go down to the step level in the test cases. What I'd like to do is just put the test case level in the test cases and then include the step level. Sorry, use the traceability matrix to say these are the test cases, and then in the test cases, include the step level of the traceability. And then when I'm testing, I only provide screenshots for the requirements that have steps tested in the test case. So the rest of the test steps, I don't bother because I'm not proving a requirement. As I said earlier, IQ, OQ, PQ are process words, and FDA did not understand computer systems, good software engineering, so we used process validation tests, and IQ is installation, and you can run your scripts. OQ can be anything, any testing that you're doing that's not user acceptance testing or installation qualification, and PQ is user acceptance testing. So in order to do this, you really need a plan and a report. You can have a test plan and you can have a report, because remember, we do everything in bookends. Now, some people say put the test plan in the validation plan. That gets too confusing. Also, as an FDA inspector would want to see the validation plan, but not necessarily the test plan. So if you put test plan information in the validation plan, again, you're opening the door to more steps in the inspection. Because remember, we're not just writing these documents for the sake of writing these documents. We're writing these documents in case something, first of all, because it's good business, because it's quality, but also in case the company gets sued either by the government or by patient advocates, you have objective evidence that everything was done correctly. So you want to make it, number one, as modular as possible, because spaghetti documents make things hard. And secondly, you want to be able to help the inspector find what they need without having to go over a lot of documents. The other thing I want to say for the test plan and the testing, I have here what should be included in the test plan, which is write a test case, execute, review, and then do exception handling. Do not have a deviation for every exception in the testing. Otherwise, you will over-kappa yourself with deviations. So what you need is use something like a test incident report, and then at the end of a project, have a single group deviation that can be used to include all the test incident reports. So you only have one deviation going into your kappa systems. For the test cases, you want to have the step, you want to have the expected result, and you want to have the actual result. When you're doing the actual result, you have to write it out verbatim. We didn't used to do that. We used to do as expected. However, what happened was there was a medical device, a radiation emitting medical device, and the person who was doing the validation read in the expected result was going to be 0.0000, so that's 4 zeros, and then the number 6. What they actually saw was 0.000 and then the number 6. So this was 10 times the amount of radiation. So they wrote as expected because they did not have to write it out. And I can't remember, 45 people died, 1,200 babies were born deformed. So now we want to write it out verbatim so that this mistake is not made. And of course, do not make the expected results to be the great American novel. Make it very concise because somebody has to write that out verbatim. And as we mentioned, IQ can be used to test configuration. So also when I do the testing, I always like to start with the backup and restore function. And the reason for this is I install the system in the Val environment or QA or whatever you call it. You back it up, wipe the system and restore the backed up system, and then execute all of your OQ on the restored system. If all the tests passed, then the backup and restore has obviously passed. You do not need to write a long script. For PQ, I use the user SOPs as scripts, and the user SOPs would reflect the requirements, either because you have used the SOPs to write the requirements or because the requirements become SOPs. So no need to write another script, use the SOPs. And then, of course, the test report will summarize how the testing went and any TIRs. Of course, you need a log of TIRs to make sure you have a table of contents of what the TIRs are. Then a validation summary report, validation registry, CSV assessment, release statement, known problems and workarounds. All these need to be there. The validation summary report, most people are familiar with. Validation registry is a glorified table of contents that gives you every single document in your validation portfolio. For example, if you have a memo, you would find it in the validation registry, the training, the SOPs, so that you do not lose any documents. You also have to have a release statement, which is the assessment of how the system actually, you have your CSV assessment of how the system actually implements GAMP 5 and CSV, and you have a release statement saying these have been met. And then if you have any known problems and workarounds, you can have that as a separate document or as part of the other documents. It does not matter where you put these separate documents or all in the validation summary report, just make sure you have them. And by the way, I like to keep them separately simply because if an auditor or inspector wants to see the known problems and workarounds, I am not opening my validation summary report for them. Then once you have that, you have your single deviation that you have come up with from all the TIRs. And it does not hurt to reference the operation and maintenance good practice guide from ISPE for anything that you're going to do once the system is in production. Or you can reference this in your validation plan. And of course, you're still referencing your validation plan for things like system description and definitions. So with all that, I would like to give you the 10 deadly sins, which were compiled by Dr. Charlie Snipes from FDA Enforcement Office, and were presented at an SQA annual conference in 2009. SQA is the Society of Quality Assurance. And Dr. Snipes used to strike terror into the hearts of those of us that had the misfortune of being inspected by him because he knew so much. And this is still valid today. So what not to do, or the 10 deadly sins of implementing GAMP 5. And I am going to start with number 10. So number 10 is lack of adequate security. Number 9, lack of hardware qualification. And this is both infrastructure and any app-related software. No reevaluation or retesting when hardware is added. This should be part of your change control. No quality assurance unit, so you cannot trust the software. Lack of defect tracking during testing. Lack of backward and forward tracing. This is your traceability matrix. Lack of records of testing and input and output of testing. And a quick side note here, I sometimes consult for investors, and I identified a company that was a fraud because they did not have input and output of testing to show me. Failure to archive all versions of the design spec or any other documents by the design spec, especially. No record of software version used. Do not just write it's this software, right? It's this software version, and you can say or higher if you want your documents to have longer shelf life. And then number 1 deadly sin that is a complete absolute no-no is no requirements. And with that, We have reached the end of this presentation, and I am now ready to take any questions you might have.
Maybe there are some technical issues. Okay. Let's
Yes,
go to the poll to hear your answers to our questions. So I believe they will launch the poll. I invite you to make use of the poll and scan the QR code. And let's see what your answers will be. Thanks again, Angela, for your compelling presentation. Apparently there was no sound. We're live, so that's live. First question, is your system's inventory manual or automated as part of a maintenance system? A, manual, B, automated but not part of a maintenance system, C, we do not have a system inventory, D, what is a system inventory, and E, none of the above. So please do vote. We are very curious to see your answers, and as they are coming in, 75% is answering manually. So sorry, not manually, but a manual. So the system's inventory is manual. Is this something you had expected, Angela?
Actually, no. I had expected that the automated as a part of a maintenance system, but it's good to see that there is a systems inventory. That is very important. And that is something that regulatory agencies look for when they are doing an inspection. So that's something you want to look into,
Okay.
getting it as part of your portfolio.
All right. Let's go to the second question. And there's always a bit of a delay. So, ta-da, there it is. Do you include both processes and data in your requirements? Absolutely. Or we describe processes but not data. We describe data but not processes, and none of the above. So little guess, Angela, what will it be? What will the most popular answer be? Oh, I'm too late.
Well, no, that's very, very pleasant surprise because apparently the last few clients I looked at, they described processes but not data. I was worried that this was an industry standard, and I really appreciate the responses. I am working on a standard for the current latest regulations. So this is good to know.
Yeah,
That
absolutely.
so many people have both. Thank you. Well done.
Right. Indeed.
Job.
Thank you for your votes. You made Angela enthusiastic. And me
happy.
too. And okay, there are quite some questions. Let's start with Manon de Couillard. We are an FDA listed medical device company. Only a subcontractor, sorry, a subcontractor, no legal manufacturer. For now, we aim at compliance to 21 CFR A20 and 11. Part 11 is limited to electronic records and electronic signatures. Do we also need to
That is
comply
correct.
to GAMP 5/21 CFR 11.10a?
So that's a really good question, and I need to clarify a little bit. So GAMP 5 is how you implement 21 CFR 1110A, as you correctly stated. However, the way that 21 CFR 11 is implemented is by including it in 21 CFR 1110A. So my suspicion is you're probably doing the right thing, but you do not know that you're doing the right thing. But yes, the answer is yes, you absolutely need to have 1110A and include everything else in 1110A.
Okay, so Manon, you are
So
doing the right thing.
possibly, yeah, possibly, but that's something that uh, you would want to look at a little bit more to make sure you're on the right track.
All right. She has another question. Our software validation is now based on low, medium, and high risk, which is ISO 13485 compliant. Do we need to change our software validation process for products that need to be FDA compliant?
So ISO 13485 is the same as, it's very similar to 820. It's really the QSR part. So you no, ISO 13485 is actually recognized by FDA as being validation compliant. But validation is 21 CFR 1110A, which sort of goes with the previous question of you're probably doing the right thing, but not understanding it. It sounds from the two questions that there is a little bit of clarification of documents required there, and just recasting them, but you're fine with 13485. Just make sure that when you're doing your validation, you have the GAMP deliverables included. I hope this helps. And we can talk after, perhaps, if you need more detail.
And to have a bit more details about the 21 CFR 820, there are some updates coming later this year. And will that induce changes in part 11.10a?
No. So what happens is any regulation that's not 21 CFR 11 is called a predicate rule. So 820 is a predicate rule. So each predicate rule is specific to a product or a process. Part 11 goes across all of the predicate rules. So if a predicate rule changes, Part 11 still remains the same. Part 11 only changes when Part 11 changes. So, and I know it's confusing. And when we were writing Part 11, we knew it was going to be confusing. But no, the answer to that is no.
Okay. Thanks for the clarification. So, Batul Belal is asking, would you recommend using GAMP software categories as a validation system for software tools used? Or would you use it strictly for software development cycles?
So I use them for software. Let me take a step back. I use them more for risk assessment of the software. I'm not sure if you're asking for a software that is a lab software or software that is non non-instrument, non-lab, but the GAMP categories are used to tell you the degree of risk you have and how much validation you need to get done. So if you have a higher category, you have a higher risk. A lower category is a lower risk, and you have to do your validation accordingly with a category. This sounds a little bit like occult and magic. However, the one way to describe it, for example, is if you have a COT software, you can use test cases that come from the vendor, and you just can tailor them to what your company is doing. So that's the way to handle a lower risk system, and a higher risk system, a higher GAMP category. You would have to write scripts and test to the detailed degree as opposed to just the, we can see in the safety software, we can check on we can tick on the severity as opposed to we have all this severity. We have the number of characters, and we have the number of, we have the options. So I hope this answered your question, because your question is sort of mixing up two things. I hope I was able to clarify.
Okay, Batul, let us know if you have an answer to your question. Akiyut Reddy, I hope I pronounced correctly. Why do we need to include non-GXP systems in system inventory?
Well, you probably already have them in your asset management software. And if you want to not include them.
Are you still there, Angela?
Electronic records, electronic.
Sorry, Angela, you disappeared for a moment. Could you repeat?
Yes, absolutely. You have to be able to show that your non-GXP systems were assessed for GXP requirements. So if you have your inventory for non-GXP systems somewhere else, that's fine. You can just keep your inventory, the VAMP inventory with your GXP systems, but somewhere you already have all your systems because those are assets. So you'll probably find that finance has the asset management software, and in that they have all your systems. But you have to be able to provide evidence that your non-GXP systems are non-GXP systems, and to do that you have to assess them and have the documentation that you have assessed them. So you can put them in a separate.
Okay. I think that's clear. I don't know if we still have time for one question. I'm looking at the technical people. Yes, one last question then. What is computer software assurance and how does it apply to GAMP 5?
Thank you. So I am on the team that is working on computer software assurance. What happens is we are streamlining validation. What I presented today is what I'm actually including in computer software assurance. So you can reduce effort, reduce errors, reduce cost, and have a higher level of quality by focusing on the things that are important and not repeating things that you do not have to repeat. So it's streamlining validation. Computer software assurance is streamlining validation. And we are working on it. And what I presented is what I'm proposing for computer software assurance.
All right.
I hope.
Angela, it has been an honor, and it was very nice to meet you and see that we have some things in common outside of these topics.
Presentation.
So I wish you a very nice continuation of your day there in California. Thanks for joining us.
Thank you for having me. Have a wonderful remainder of your day. Take care.